Government Employees Medical Scheme is holding its annual symposium, focusing this year on closing the information gap between members' healthcare experiences and the realities of the healthcare system. Let's now go to SABC News reporter Mkhokheli Bandla. Mkhokheli, good morning to you.
Good morning, and once again, and to our viewers at home. Indeed, we're coming to you once again live from Cape Town Century City Conference Center, where you have correctly alluded in your introduction that the Government Employees Medical Scheme is hosting its annual symposium, where now the theme, as we have already said earlier, that they are wanting to put more efforts in terms of closing the gap between the members of the scheme and their daily experiences and what the healthcare delivers and how it is defined, and actually to get now strategies in terms of how they are going to be dealing with that. We are joined now by the Chief Strategy Officer of the Government Medical Aid Scheme, that is Masingita Chavalala. Masingita, thank you so much for joining us. Now, talking strategy in terms of how the scheme plans to close the gap between the members of the scheme and also what the healthcare system delivered and how it's designed. How are you going to approach that strategically?
Thank you so much, and good morning to you, Mkhokheli, and the listeners. So one of the objectives of GEMS is to be a data-driven scheme. And by that, we simply mean that we understand what it would mean to have access to data and how that influences our decision-making processes. Equally, we're saying our members need access to data, right data, the correct data, clean data, simplified data for them to be able to understand. And for this, it will enable them and empower them to make strategic healthcare decisions for themselves and their families. So what we plan to do as part of our strategy is just to always ensure that our communication is streamlined. There are various channels in which we can provide this data, face-to-face, through our digital platforms as well, and through our walk-in centers. And through all the process, we always ensure that we gather member data, we gather member sentiments, so that when we go back to them and give them the information, we know how they would want to receive it so that they can understand it better.
Streamlining communication between the scheme and the members, how would you say, what are the gaps have you identified in terms of that aspect of streamlining the communication? Is there a connection between the scheme and the members?
So one of the things that we always ask ourselves is that if our members have to navigate complex information, complex data and jargon, then we are really losing them and we're failing them. So one of the things that we've done is to simplify the way that we write member brochures, the way we communicate. And equally to that, when we write our strategies, we make sure that we write it for our members. Sometimes we write these glossy documents that are written for the board and for the bigger audience. But when we speak to our members, we speak in languages that they understand, in simplified manner in which they understand. And we always say to them, we are open for the feedback. Even where we are find ourselves wanting, we accept the criticism so that we can come back strong and speak to the members in a language that they understand.
Talking to a member listening now at home, what would you say this symposium mean to them?
So the symposium focuses on bringing healthcare industry people to say what has been the gap, what has been missing. So as an industry, have we collaborated enough to understand what members face on the ground? And the collaboration is critical. Collaboration with our providers, our service, our networks as well, because from that point of view, our providers are the ones that service our members. So we have to understand from the providers what they plan to do, what they commit to do, to be able to ensure that we close that gap with our members, because we can sit in our head office, but our members go to doctors, they go to specialists. That information must be solid, it must be accurate, and they need to be able to service and speak to them in a language that they understand. The symposium seeks to do that. And when we come out of the symposium, we want members, our providers, to commit to that. And we will hold them to that because we've got contracts with them, we've got service level agreements with them. And through that, we will hold them to the commitments that we would have made to ensure that the information and the data that needs to go to members actually filters down to our members.
In terms of practicality now, and in terms of the expected outcomes of this symposium, how would you say you would apply the outcomes of this practically now to your member?
So I mean, you've got your walk-in centers and you've got your client liaison officers. Some of them are attending the symposium, some are attending physically, and some are attending online. And through listening to some of the suggestions and the solutions that are coming in, they are the channel and the vehicle to take that information to our members, because they are the ones that deal directly face-to-face. And equally, like I mentioned, our strategy, we're actually moving to the new strategy now. And through that strategy, we are saying to our providers, we need to see clean initiatives. We need to see new initiatives that are saying we are committing. And sometimes, you commit through the pocket. And then you simply say, put your money where your mouth is, and let's build digital platforms. Let's innovate so that we can give the information to the members, the information that the members need.
Thank you, Masingita. There you have it, Leanne. That is Masingita Chavalala, the Chief Strategy Officer of the Government Employees Medical Aid Scheme, where they are actually saying they are putting more efforts in terms of closing the information gap between their members and also the healthcare system, how it responds, and how the challenges that they face every day. So that is what is happening here in Sanctuary City Conference Center in Cape Town.